Hi, I'm Dr. Martinez, and I'll be talking about neurofibromatosis. Neurofibromatosis consists of two different conditions, neurofibromatosis type 1 and neurofibromatosis type 2. These conditions may affect your brain, spinal cord, or nerves. The tumors that grow along your nerves may not be cancerous, but there is always a chance of them being cancerous. First, I'll be talking about neurofibromatosis type 1. I'll be talking about the explanation, the causes, the diagnosis, the symptoms, treatment, and whether they can have children. I'll be first explaining what neurofibromatosis is. Neurofibromatosis is also known as von Recklingh's disease. Neurofibromatosis type 1 is the most common condition out of the two. It is a genetic condition that causes tumors to grow along your nerves. Even though you were born with NF1, you may develop symptoms as you grow of age. I'll be talking about how you diagnose it now. It is typically easy to diagnose NF1 in adults or older children by looking for their symptoms. As for babies, it can be diagnosed at birth but isn't always accurate because they develop symptoms as they grow. I'll be talking about the causes now. NF1 is caused by a faulty gene. If the gene ends up being faulty, it can lead to uncontrolled tumors in your nervous system. This condition can be either passed down from a parent or it can spontaneously appear. Many don't know why this happens. If it does happen, though, your future children do have a chance of getting it. For neurofibromatosis type 1, there are 4 different symptoms. There are birthmarks called cafe au lait spots, soft non-cancerous tumors on or under the skin, also known as neurofibromas, clusters of freckles in unusual places, and problems with bones, eyes, and the nervous system. For neurofibromatosis type 1, there are multiple different options for treatment. You can go get surgery to remove the tumors or surgery to treat problems with bones. You can get medicine, physiotherapy, psychological support, and pain management. For NF1 patients, if they want to have children, they need to seek many different options. They can adopt, get a donor egg or sperm, take a test to see if your kid can have NF1, or testing the egg to see if the egg has NF1 before putting it in the womb, also known as pre-implantation. Now I'll be talking about neurofibromatosis type 2. I will explain it, talk about the causes, the diagnosis, the symptoms, the treatment, and whether they can have children. I will now be explaining what neurofibromatosis type 2 is. Neurofibromatosis type 2 is also a genetic condition that causes tumors along your nerves. They are non-cancerous, but there is always that chance of them being cancerous. About 50% of the people inherit this gene. The difference between NF1 is that they have different symptoms and they have different causes. I will now be talking about the diagnosis of neurofibromatosis type 2. It is also easy to diagnose, just like NF1. It can be found in teenagers and older people. It is also harder to diagnose babies because they still haven't developed their symptoms yet. I will now be talking about the cause of NF2. In neurofibromatosis type 2, it is also caused by a faulty gene. This faulty gene can lead to tumors in your nervous system. It is a 50% chance that you can get this condition from a parent. The other is 50% spontaneous. NF2 is a form of this disease called mosaic NF2. Only 1 in 3 people have this form of NF2. People that have this form have a 50% risk of a child with neurofibromatosis type 2. Okay, I will now be talking about the symptoms of neurofibromatosis type 2. So the symptoms do progressively get worse. You suffer from hearing loss, ringing or buzzing in the ears, balancing problems, typically when it's dark or on uneven grounds, tumors in your brain, spinal cord, or along your nerves. The tumors also make you weaker and make persistent headaches. Okay, I will now be talking about the treatments you can get for NF2. So, unfortunately, there is currently no cure for NF2, but you can get regular monitoring. You can get surgery, but there is always a risk that you can go deaf or have facial weakness. Like I had said, NF2 does get worse and you develop significant hearing loss. For the hearing loss, typically people use hearing aids or they learn how to read lips. So now I'll be talking about the chance of children for patients with neurofibromatosis type 2. So there is options to have children. You can adopt a child, you can get a donor egg or a sperm, take a test to see if your kid can have NF1, or testing the egg to see if it has NF1 before being put into the womb, which is also known as pre-implantation. These options also go along with neurofibromatosis type 1. They give the same opportunities to both types of conditions, and they're very lucky that they get to these options. Thank you for listening to my research on neurofibromatosis.